Hello everyone. Being in Fmge is not that easy. There are lots of chaos happening in the country. However, our national faculties have taken in charge. Students who have already cleared Fmge are also working very hard for the welfare of the Fmges. So for those students who are giving the July 2024, please don't get distracted with these happenings. Try to focus towards your studies. We hardly have another few weeks left. So remember, these 3 weeks is going to change your life. Therefore, stick to your schedules, focus towards the goal, and you will achieve it. We will handle the rest. Now, let's discuss ENT with the past 5-year topics. Now, let's start with ear. What is the structure here? This is called as what? Pinna. It is supplied by greater auricular nerve. It is made up of what? Yellow elastic cartilage. Yellow elastic cartilage. And there is a canal passing through. What is this called as? External acoustic canal. It is going to be 24 mm in length. 24 mm in length. 1/3, remember, 1/3 is made up of cartilage. Yes, you can see the cartilage here. This is made up of cartilage, 1/3. And remember, 2/3 is made up of what? The bony part. Yes, the bony part is going to be 16 mm in length, and the cartilage is going to be 8 mm. Good. Next, here we have the tympanic membrane, which is going to be pearly grayish in color. Right next to it, we have malleus, incus, and stapes. And here we have the cochlea, which is having 2.5 turns, and then the semicircular canals. Very good. Let's discuss about pinna. So what is this structure here? This is called as what? Helix. And this is going to be anti-helix. If this is absent, it is called as what? Bat ear. It is called as bat ear. Good. There is a small projection out. If you see that in helix, that is called as what? Darwin's tubercle. Good. Next, moving on to otitis externa. Look at the image carefully here. This is caused by staph aureus. Yes, in this case, you're going to give ecthamol glycerin packing. Very important. And look at the image here. What is this image here? This is going to be hematoma, which is pinna hematoma. It is caused due to what? Trauma or punching. Now, what is the treatment, sir? You're going to aspirate. Treatment is going to be aspiration. Good. Let's revise the ossicles. So we know there is going to be malleus, incus, and stapes. Now, few points about stapes. Stapes is going to be the smallest bone in the body, and stapedius is also the smallest muscle in the body. Now, if this stapes, the stapes over here, if it gets fixed to the bony part, it is called as what? This condition is called as otosclerosis. We will study in detail about otosclerosis shortly. Good. ASOM, acute suppurative otitis media. Now, it is caused by Streptococcus pneumoniae. Please do remember ASOM, caused by Streptococcus pneumoniae. Infection is going to lead the infection of the medulla, and if a red bulging, if seen like this, what you're going to do? You're going to do myringotomy at the posterior inferior quadrant. Posterior inferior quadrant. Close your eyes. ASOM, caused by Streptococcus pneumoniae. It is going to be medullary infection. And third, you're going to be remembering red bulging. You're going to do myringotomy at the posterior inferior quadrant. Very good. Next, moving towards trabecular otitis media. Remember, trabecular otitis media, it is going to have what? Multiple perforations. As we can see, you're going to see multiple perforations. It is going to be painless. See, someone having multiple perforations in the eardrum is not having any pain. It is going to be what? Painless. Patient will tell she or he is having no pain. In the otoscope, when you examine, you will see lot of perforations like this. Now, it could be also refractory to antibiotics. It can lead to what? Severe deafness by necrosis. And what are you going to give for these patients? You're going to start anti-TB therapy along with cortical mastoidectomy. Yes, cortical mastoidectomy. Good. Malignant otitis externa, it is probably a misnomer. It is not malignant, but it is very dangerous. Now, it is going to be life-threatening condition. You can see there has been a discharge coming out. You can also see the granulation tissues here. It is quite dangerous. Now, it is life-threatening, especially to the underlying bone of EAC. Yes. Next, it is also going to cause what? Severe ache in the pain, especially to whom? Diabetic patients. Yes. Now, as we see in the image, we can see the granulation tissue and seventh nerve, facial nerve involvement is seen. Remember, malignant otitis externa. Next, something to remember more is going to be, it is caused by pseudomonas. As a treatment, we are going to start what? Third generation cephalosporin. Let's talk about Meniere's disease. First, we look into the normal inner ear and then the Meniere's disease. In normal inner ear, the endolymphatic sac, look at this, endolymphatic sacs, they're all normal. Whereas in Meniere's disease, the endolymphatic sac is getting bulged out, and this is due to poor absorption of the endolymph. This condition, Meniere's disease, is also called as glaucoma of the ear. Remember, it is due to poor absorption of the endolymph. In this condition, we are going to see recruitment phenomenon and also Tullio's phenomenon. Patient is going to hear double voices, which is called as diplacusis. As the treatment, we are going to do endolymphatic sac decompression therapy or surgery. Next, it is also, we are going to inject transtympanic injection of gentamicin is done. Good. Let's talk about glue ear, which is also called as serous otitis media. Some of your schoolmates probably might have also undergone grommet insertion for glue ear. After decades, one of my close friend told me that he got insertion of grommet for what? Glue ear. Now let's see what is glue ear. This is going to be thick and sterile. It is going to be glue-like fluid in the middle ear. Remember, glue-like fluid in the middle ear. Especially seen in school-age children. It is not painful, and if it is not treated, it can lead to conductive hearing loss. So, what we are going to do? We are going to do the surgery, which is called as myringotomy at the anterior inferior quadrant, myringotomy. Remember, for ASOM, myringotomy was done at posterior inferior quadrant. Very good. And also we are going to do grommet insertion. Look at the image here carefully. And this is the image of what? Glue ear. Good. Otosclerosis is very important as well. Recently asked in the exam. Let's dive into details. Now, otosclerosis. What is going to happen here? Remember, the stapes. We all know this is malleus, incus, and stapes. It is when the stapes gets fixed towards the bony part, moving it less flexible or less vibratory. If it gets stuck, the movement is not going to be that much, and this leads to a condition what? Otosclerosis. Remember, the symptoms of otosclerosis are going to be hearing loss, tinnitus, which is going to be a ringing sensation in the ear, and the patient can also have what? Dizziness. questions which were asked was about Carhart's knots. There is going to be a dip in 2000 hertz. Very good. Let's try to revise cochlear implant. The word itself says cochlear implant, connected to the cochlea. If you look at the image carefully here, the electrodes are getting connected to cochlea. Yes, here we can even see much better. Very good. What you're going to remember for the main exam is that the electrodes are implanted at scala tympani. Remember, at scala tympani, at the round window. Cochlear implants are usually suggested to patients who are having bilateral hearing loss. Bilateral severe hearing loss. Yes. And do remember, it is only done in patients where the eighth nerve is intact. When the eighth nerve is intact. Yes. In case of brainstem implants, they are used in retrocochlear disease. Great. Look into the image here. The cochlear implant, it has a transmitter, it has a microphone and a speech, and the electrodes. Look into the image. What is this? This is going to be the transmitter. Here is going to be the speech processor and the microphone. Good. Let's revise Laryngomalacia beautifully. Look at the normal epiglottis. This structure is called as what? Epiglottis. And here we have the epiglottic fold, and down below we have the arytenoid process, and this is going to be the V-shaped one, is going to be our vocal cord. In case of Laryngomalacia, what happens is that the epiglottis becomes omega shaped. It becomes omega shaped. It becomes omega shaped. Very good. Very important for the exam. Therefore, in this case, the patient is going to have what? Stridor. The patient is going to have stridor. Yes, it is going to be commonly seen the first week after birth. In this case, what you're going to do, you're going to go for conservative treatment and reassure the parents that it's going to be fine in the coming days. Okay, so this is going to be what? Laryngomalacia. Good. Let's discuss about Laryngotracheobronchitis, which is also called as what? Croup. Look at the image here. It is going to have what? Steeple sign. Very important. Commonly asked in exam. It is caused by which virus? Para-influenza virus. Very important. The patient may have what? Biphasic stridor and also respiratory distress. In this case, you're going to give airway management and also bronchodilators. Remember, bronchodilators. Next, moving on to acute epiglottitis, we are going to see classically a thumb sign. Thumb sign. Remember, it is the infection of supraglottis, and which is the organism causing it? Streptococcus pneumoniae. It is a bacteria. Therefore, the patient can have what? High fever and drooping of saliva. Tripod sign is commonly seen with hot potato voice. Acute epiglottitis, we are going to treat the patient by giving secure airway, intubation, and we are going to start antibiotics as it is caused by a bacteria, and also we are going to give steroids. So remember, laryngotracheobronchitis and also acute epiglottitis, very important topics. Ludwig angina, it is going to be cellulitis of the submental and submandibular region. It is caused by streptococcus. Please do remember. We are going to remember Ludwig angina by 4 C's. First C is going to be the caries of dental. Second C is going to be calculi in the submandibular gland. And third will be cancer of the oral cavity. And fourth is going to be in case of chronic diabetes. Very good. What are the clinical features? Comes to the mnemonic called as HOPE. H is for what? High grade fever. O is for edema. P is for putrid halitosis, which means bad breath. And then it is commonly seen in elderly patients after 45. Good. Look at the image here. This is going to be what? Zenker's diverticulum. Yes, I hope you will revise this very well in surgery as well. There is going to be outpouching at the upper esophageal sphincter, remember the patient is going to have dysphagia, more to solids than liquids. Very important. Next, what is this here? This is going to be this image of posterior cricoarytenoid. It is the only abductor of the vocal cord, and in RLN paralysis, recurrent laryngeal nerve paralysis, abduction is going to be impaired. Yes. And what is this image here? This is going to be rhinophyma. It is going to be hypertrophy of the sebaceous gland. Good. Let's look into the Adam's apple, which is the larynx. Remember, it connects the pharynx with the trachea. Yes, look at the image of the larynx. This structure, leaf-like structure, is called as what? Epiglottis. And then here we have the hyoid bone. Down here we have the cartilage, which is the thyroid cartilage. Remember, laryngeal prominence is called as what? The Adam's apple. Laryngeal prominence is called as Adam's apple. Great. Next, Corynebacterium diphtheria infection. This is how it's going to look like. This has been asked in the exam. Please do revise. Look at the image here. This is going to be what? Frontal mucocele. What do you have to remember for the exam? It can extend to the opposite side, and this can cause what? Erosion to the supraorbital ridge. Yes, the supraorbital ridges can be eroded. That is why it's very important. Please remember. Let's try to quickly revise peritonsillar abscess, which is also called as what? Quinsy. Called as Quinsy. Called as Quinsy. Look at the image here. This is what? Uvula. Here is going to be the tonsil, and this is swelling right over here. This is called as what? Peritonsillar abscess, called as Quinsy. It is caused by Streptococcus pyogenes. Very important. The pus gets collected between the capsules of tonsil and tonsillar bed. Okay. Patient will have what? Dysphagia, hot potato voice, and also have severe throat pain with or without trismus. Now, the tonsillar is getting pushed towards the anterior medial, and the uvula pushed towards the opposite side. Great. What we are going to do? Immediate IND and also interval tonsillectomy. Very important. So we can see the bulge here. What is called as peritonsillar abscess or Quinsy. Good. Let's try to quickly look into the images. What is this called as? I hope everybody knows this. This is going to be leukoplakia. And what is this? This is going to be ranula. And here this is going to be what? The image of Koplik spot. And then here what is this? Corynebacterium diphtheria. Caused by Corynebacterium diphtheria, has been asked in the exam. Please remember. Let's try to revise the x-rays of the paranasal sinuses, which is very important for the past few years exam. Let's hope that we may have some questions coming from here. Let's discuss about the x-rays of the paranasal sinus. Let's start with the easy one, lateral view. In lateral view, we can see all the four sinuses. Very easy. Lateral view or four sinuses. In Caldwell view, it is of what? Occipito frontal view. Occipito frontal view, we can see what? Frontal sinus. Frontal view, frontal sinus. In Waters view, remember, occipito mental view, we can see M for maxillary sinus assessment. Pierce view is for what? Sphenoid sinus assessment, and the mouth is going to be opened. So please remember Pierce view. Headaches are quite common before exams, but try to avoid it. Try to meditate, and good things will happen for you guys. Wish you all the best. So keep revising. Now, headaches are quite common. Most common headaches are going to be tension. That is going to be tension headache. Yes, as the exam is approaching, we may also have lots of headaches. When I place my head towards my frontal region, what headache this could be? This could be what? Tension headache. Yes, the pains are going to be in the frontal region. In terms of sinus, the pains are going to be behind the brow bone and the cheekbones. In case of cluster, it is going to be around the eye. In case of migraine, remember half of the region having towards the head pain. The patient may also have what? Nausea and also visual changes. Good. Now, look at the image of fossa of Rosenmuller. This is the image here. Try to remember. Good. Let's discuss about juvenile nasopharyngeal angiofibroma. Remember, this is what it is. It is the most common tumor of the nasopharynx. Site is going to be at the sphenopalatine foramen. Very good. It is going to be commonly seen in children, boys at the age of 12 to 14 years, and it is a highly vascular tumor. Remember, it is a highly vascular tumor. Frog face deformity is seen. In CECT, we are going to see Hallman-Miller sign and Antel sign. Surgery is going to be embolization and surgical excision. Very important. Yes. Let's discuss about CSF rhinorrhea. Very important. Remember, it is caused due to trauma. You're going to see very important sign which has been commonly asked. This is called as what? Halo sign or target sign. Yes. Next, what is this image here? This is the image of battle sign. You're going to compare with 4Bs. That is going to be battle sign. We are going to see bruises, basilar skull fracture, and also it can be seen basically behind the ear. Yes. Atrophic rhinitis, another important topic. Remember, it is going to have these mucus crusts. It is due to atrophy of the turbinate. Roomy nasal cavities are going to be seen and the nasal gets blocked. There is going to be very bad smell from the patient, but the patient is lucky because he cannot smell his own. And that is called as what? Merciful anosmia. In French, merci, it means what? Thank you. So, thankful to the patient. Next, infection, it is caused by Klebsiella oceanae. Treatment is going to be alkaline nasal douching. Surgery is going to be what? Young's operation. Very good. Please look at the images. Accidental passage of coins in trachea and esophagus have been a hot topic over the past few years. Let's revise them very quickly. If a child presents to you in the hospital via an accidental ingestion of the coin, you're going to take an anterior view and a lateral view. In the anterior view, remember, if the coin is in vertical, it means it is in trachea, and in the lateral view, this is how it's going to be looking like. In case of esophagus, remember, the coin is going to be like this O shape in the anterior view. So if you see this image, please mark it as the coin is in esophagus, and this is how it's going to be in this view. Good. Now, types of papilla, remember, there is going to be fungiform and foliate, and this is an example of what? Circumvallate papilla. Good. Mucormycosis has been a very common term even for non-medicos during the COVID time. Everybody knows this commonly happens to which patients in diabetes, and this also happened to patients who were ingested what? Steroids. Good. Now, it is an infection of the nose caused by fungus. It is actually seen in young diabetic and also HIV positive patients. Mucor, remember, it is an angio-invasive fungus. It can enter into the orbit and also into the brain and causing blackish discoloration around the orbital region and nose. What is the treatment, sir? We are going to give liposomal amphotericin B. Good. Triads can also possibly give us a couple of marks. Therefore, I compiled important triads in one slide. Let's revise them quickly. What is this, sir? First, let's discuss about Alport syndrome and Hutchinson triad. Alport syndrome, remember, sensory neural hearing loss, ocular anomalies, and renal failure. Hutchinson triad, remember, Hutchinson teeth, intestinal keratitis, and nerve deafness. Once again, Hutchinson teeth, intestinal keratitis, and nerve deafness. In Cartagner syndrome, remember, bronchiectasis, recurrent sinusitis, and situs inversus. In Melkerson-Rosenthal syndrome, remember, very important, it is going to be what? It is going to have recurrent facial palsy, facial edema, and plication of the tongue. Good. In case of congenital rubella syndrome, it is going to be cataract, deafness, and patent ductus arteriosus. Last but not least, Samter's triad. You're going to remember bronchial asthma, aspirin sensitivity, and nasal polyp. Good. Please do revise Alport syndrome, Hutchinson triad, Cartagner syndrome, Melkerson-Rosenthal syndrome, congenital rubella, and Samter's triad. So with this, we concluded ENT IEL topics. I hope it was useful. Please be positive. No more unnecessary thoughts, no more distractions. the couple of weeks will change your life. So it's going to be very important for all you guys. Stay focused, stay revised. If anybody wants these slides, please DM me in Instagram, Dr.Auroraj, and then I will send you the files. And keep revising well. I have a huge hope that you all going to pass. Wish you guys all the best and cheers. Thank you.